Hi, my name is Jennifer Bellamy, and I'll be doing my assessment on the nose, mouth, and throat. I have my consent form that my patient has filled out, allowing me to tape her and post this on the internet for my teacher to see. First, I'm going to start out by examining her external nose. I'm going to make sure it's symmetric and make sure it's midline and in proportion with the rest of her face. All right, it's midline, seems to be in proportion with the rest of her face. And I'm going to look for any kind of deformity or inflammation or skin lesions or any kind of peeling of skin, and I don't see any of that on the external nose. Next, I'll palpate the nose, and I'll make sure the patency of each nostril is open. So if you would, sniff in, okay? And each nostril is patent. I will be looking at the nasal cavity next with my otoscope. I'm going to gently lift the front of her nose and look inside of her nasal cavity, and I'm going to be looking at the septum and the turbinates. I'm going to make sure that it's a good red color and smooth and moist and surface, and there's no swelling or discharge or bleeding. And I will explain what each of those are after I come out of the nose, so I don't have to stay up in the nose the whole time, but I will be looking at the septum and the turbinates. Okay, I did both nostrils, and the septum is not deviated. It is very straight, and the surface of the nostrils is red, just like it's supposed to be, moist, and there's no bleeding, swelling, discharge, or lesions. The septum is not deviated. There's no perforation or bleeding. It was nice and straight, so no deviation of the septum. The turbinates, those are the bony ridges that curve down from the lateral walls, and you can't view the superior ones, but you can do the middle ones and the inferior ones. And it should be the same red color as the nasal cavity, which it is, and there was no swelling, no polyps, no exudate, no problems with the turbinates or the septum. Next, I'm going to palpate the frontal and frontal and maxillary sinuses, and I'm going to ask the patient if there's any pain with those. Pain?
No.
And maxillary?
No.
No? Okay, I'm putting some pressure on there, not firm pressure, just to make sure there is no tenderness or pain associated when I touch her sinuses. Next, I'm going to look at her mouth. I've got my pen light here. I'm going to look at her lips first, and I'm going to make sure that they're moist, they're not cracking, they're not dry, they don't have any lesions on them. Then I'll be looking in the inside and the outside of the lips. I've already washed my hands. You can just close your mouth. There you go. All right, the outside looks good. All right, inside, I'm just going to pull your lip down. Get the buccal mucosa. Everything looks good. Now with the upper lip. I don't see any bleeding of the gums, no exudate, no lesions, no ulcerations. Everything looks good with the inside of the mouth, the lips, and the structures are intact. They are very even and symmetrical. The teeth, I'm going to look to make sure there's no disease. Make sure all the teeth are white like they should be. Make sure they're in alignment. There's no loose teeth. Everything looks good with the teeth, no decay, they're clean, and they are not abnormally positioned. They're nice and white and evenly spaced. Now, I'm going to pull the lip down again and look at the gums. I'm going to make sure it's a good coral to pink color and with a nice stippled surface. The gum margins at the teeth are going to be well defined with no swelling, bleeding, exudate, and they are going to be firm at the teeth. Okay? They are. I don't see any bleeding. Nice, firm gum line, everything looks good with the teeth. The tongue, it should be a nice pink color, and there should be taste buds on the top, and there should not be any lesions, and the dorsal surface should be rough. So, all right, tongue looks good. Dorsal surface is rough. All right, can you put your tongue to the top of your roof of your mouth? All right. Those are veins down in the bottom underneath the tongue, and those are nice and smooth. The ventral surface underneath is nice and smooth, and it has saliva and veins, and it's also nice and glossy. I'm going to also look at the side to side to make sure there's no patches or no nodules or ulcerations. All right. All right, that is looking good. No ulcerations, no nodules. Everything with the tongue looks nice. No problems with the tongue. The buccal mucosa also is pink, smooth, and moist. No lesions, no nodules. And there is a raised occlusion parallel line I did notice in the sides of each of her buccal mucosa from where the parallel toward the teeth meet, and that's an absolutely normal finding. I'm going to next examine the palate, the anterior and posterior palate. The anterior palate should be white and a regular transverse rugae, and then the posterior should be pinker, smooth, and it should move upward. It should be intact. Okay, stick your tongue out and say ah. All right, the uvula. It is a fleshy pendant that hangs in between the throat, and when she says ah, the soft palate and the uvula do go up in the midline, and that is cranial nerve number 10, the vagus nerve. And when she sticks her tongue out, that is cranial nerve number 12, to show that those are intact. Do you have your tonsils?
No.
So if she did have her tonsils, I would have graded those on a scale of 1 to 4. The pharyngeal wall is off to the center of the tongue, and it's pink, nice color, no exudate, no lesions. Her breath is good. There is no need for bimanual palpation because there are no issues that I see with the mouth. And that concludes my mouth and nose and throat presentation.